Fine. Next, we'll move on to this table of drugs and chemicals. You might have seen several patients, they might have taken alcohol, consumed a poison. Take for example a phenol poisoning, insecticide. A person has consumed phenol in order to take his own life, say as a method of suicide. Then here you should understand certain things, whether this particular instance is a poisoning or an adverse effect, or is it an underdosing. Coming to coding of these drugs and chemicals, there are various classifications like poisoning, adverse effect and underdosing. What do you mean by poison? So poisoning again can be classified into various types. So first you need to determine whether it is an adverse effect or a poisoning. So what is poisoning? Taking overdosage becomes a poison. There is no prescription involved there, just a person is consuming it, that becomes a case of a suicide. If somebody else is going to give poison, say to a kid, so that becomes a case of an homicide, that is an assault. So while coding this poisoning, what you need to know is whether if this is a circumstance of a suicidal attempt or a homicidal attempt. In the sense, we call that as an assault. Somebody else is giving the poison. So whether it is suicide or a homicide, or whether it is unspecified, in the sense it is not known, or it can be accidental, that's we call that as an unintentional poisoning. So these are the classification. We have something called unintentional, intentional and undetermined. If it's going to be intentional, is it suicide or is it an assault? That you should know, whether somebody else has given or this patient himself has consumed, because we may not know. Most of the time we may not know, because patient might become unresponsive and unconscious. At that time the physician can very well document it as undetermined, but still it is better to query once a person comes or the patient comes back to consciousness. It's always better to query and document it. But mostly we can figure it out whether it is, because not everybody is going to consume a poison out of some financial stress or any other mental stress or family disruption. Okay, now coming to the coding of it, what is a difference that's going to make, that we need to know. Okay, before that, what is an adverse effect?